Manitoba's renal transplant program is receiving international recognition for research and achievement in clinical outcomes. One of the individuals responsible for those successes is Dr. Peter Nickerson. In 2000, Dr. Nickerson and his team identified that they were losing some transplanted kidneys earlier than what was expected.
We didn't understand why we were losing them early. And when we went back and looked, we found that these new techniques for detecting antibodies, very low levels of antibodies, turned out to be positive when we didn't think there was an antibody present. And what happens is you put the transplant in, you didn't know the antibody was there, and now the immune system actually revs up and can rapidly destroy the graft using that antibody to target the kidney.
They began using a new process called the flow cross match technique.
We were able to identify those people who shouldn't be getting a transplant and thereby avoiding those antibodies. We went from a 1-year graft survival rate of about 92% up to a 1-year graft survival rate now of about 98%. So we saw a significant jump up in our short-term graft outcomes, and that translated into saving 1 or 2 kidneys a year from being lost. That's obviously significant for somebody who's just donated a kidney, having expectations that it's going to last for years, and to find out that it didn't last 2 weeks. Right? That's very difficult for a donor, and obviously devastating for the recipient, who was having huge hopes on this new life that they were going to receive through this kidney transplant. So moving to these new technologies has really improved the quality of our outcomes in our program.
A national consensus meeting was held in Montreal in 2005. It was determined that these new technologies needed to be standard practice.
It took a while, but after several years, we were actually able to transform all the labs that support transplantation in Canada up to this new standard of practice.
Manitoba's renal transplant program has also introduced innovative processes in monitoring post-transplant that are leading to significantly improved outcomes.
In Manitoba, we're one of the leading groups doing post-transplant monitoring, where we're actually not just looking at are you compatible at the time of transplant, but in our clinical lab, we're following you after the transplant on a regular basis to detect whether or not you're starting to form antibodies against the donor.
The lab is constantly busy, not only working on specimens from patients who are receiving transplants today, but on carefully monitoring all potential donors and recipients in order that when a kidney is available, much of the pre-matching has been done.
We have patients who are on the wait list. We have about 250 people in Manitoba at any one time who are ready to receive a kidney transplant if a donor became available. And so to maintain them ready to be transplanted, we have to be constantly monitoring their blood to make sure what antibodies they have or don't have, and so that we can predict what the cross-match would be.
While the Transplant Immunology Lab looks like a big, cold room filled with test tubes and various blood and tissue samples, for the people who work here, it is a critical piece in providing exceptional service to real people.
We meet most of the recipients in person. We draw their blood when they first go on the list. And if they have a living-related donor, we will often meet them as well. So we will get to know them. We'll see them several times before their transplant. And they'll tell, you'll find out a lot in the 5 minutes you're drawing blood from them. They're very enthusiastic about the process, as we are.
And the possibilities of their life-changing.
The possibilities are endless.
While the work in the Transplant Immunology Lab means increasingly successful outcomes for kidney transplant recipients, Dr. Nickerson stresses that more organ donation is desperately needed to supply the demand for this life-saving treatment.
The key step is for families to know what your wishes are. Alternatively, go onto the website and sign up for life.ca, where you can actually indicate right there that you want to be a donor. And if you do that, then when you are in that crisis situation, if your family doesn't know what your wishes are, we can show them what your wishes are. And that way, they'll feel comfortable going ahead with you being an organ donor, even though you may not have told them. Best thing, though, tell your family what you want.